And good afternoon, everyone. Thanks so much for joining us for this Thursday's COVID-19 press briefing. Today, Orange County Mayor Jerry Demings will have a special recognition of some very deserving individuals. The mayor will also have an update on our continued fight against the COVID-19 virus, including information as to where you can still get vaccinated. The mayor will also discuss testing locations, positivity rates, and the work of our strike teams. And we do also have with us some super duper healthcare workers in our midst as well that the mayor will talk about. Orlando Mayor Buddy Dyer could not be here with us today. However, epidemiologist Alvina Chu from the Florida Department of Health in Orange County is here, along with Comptroller Phil Diamond with an update on TDT revenue. We begin this press event with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson, and thank you to all of you for being here today. As we begin, I'm going to share some platitudes today with various individuals who have assisted us. This is the 131st news briefing that we have done since last year. And so I'm going to begin with recognizing our American Sign Language interpreters who have been by my side each of these 131 news briefings. They continue to play a critical role in informing our hard of hearing residents, and I'm privileged to work alongside them. So in light of yesterday's National Interpreter Appreciation Day, I want to celebrate these talented individuals. So. All right, thank you all for joining me and recognizing them. So as we begin really the remainder of the press briefing, I want to touch on a number of different things today, but I want to remind all of us that we are still very much engaged in the fight to get as many of our residents vaccinated as possible so we can move about our county and safely welcome visitors to Central Florida and keep our economy churning. We can't let up because it is important to remember that there are still 200 to 300 new coronavirus cases in our community being reported each day. 137,000+ of our residents have contracted the virus. So far, 1,265 of our residents have died as a result of the pandemic. 4 new deaths were reported to the Department of Health just yesterday. 4,500 new infections were reported in Florida yesterday. And 71 more residents died of COVID-19 in our state yesterday. COVID-19 remains a serious public health threat, and it is one we in Orange County have never taken lightly. To the families who lost a loved one to this virus, I want you to know that your family member mattered to me and to this community. We ask that you keep the faith on this National Day of Prayer. I began today by attending an early morning prayer breakfast in Apopka. The United States Congress has designated the first Thursday of each year as National Day of Prayer. And so I'm reminded that we are indeed one nation under God. So as we fight and wrestle with the pandemic, I want us all to remember that. On Monday, the governor's executive order was put in place, and it essentially eliminated the ability of local governments to issue executive orders. I want to remind you that the sole purpose for our executive orders are to protect the lives of our residents and visitors to Orange County. Since Monday, I have been asked many times now by our residents, what should they be doing? Because they don't feel safe going maskless or being in environments where others are maskless. So I'm offering the following guidance. I am strongly urging all residents and businesses to follow the phased approach I outlined last week. Many of our largest employers have already consented to following this phased approach. Please continue the wearing of facial coverings. When we reach 50% immunity in the community, we can all safely move outdoors without a mask. Right now, we're at 46.17%, or nearly 46.2% of our residents 16 and older who have at least one dose of the vaccine. We are therefore less than 4% away from achieving the 50% mark. When 70% of our county population has had one or more doses, we can return to our pre-pandemic ways and not wear a mask. We have a responsibility to protect ourselves and protect others by following the CDC guidelines. Again, I urge our residents and businesses to not give up on getting the vaccine, nor give up on wearing facial coverings. If we give up now, the consequences may be catastrophic. I've lived in this community all of my entire life and have been in public service for 40 of those years. My job and that of the other healthcare experts is to give you the best advice possible, and we will continue to do that. I know that by working together, we can make a difference and end this unprecedented health crisis. So let me just say to our community, thank you for your confidence in allowing the experts to help guide you through this pandemic. You have listened to me as Chief of Police, as Director of Public Safety, as Sheriff, and now as Mayor. There were some tough times that we had to get through. A number of crises over that 40-year career that I talked about. So I'm just asking the public to continue to do the same thing now. Listen to the guidance that we are giving you to help keep you safe in our community. Since Tuesday, our free walk-up COVID-19 vaccination sites have been open at 4 of our Magic Gyms throughout the county. No appointments are needed, and the sites can do up to 1,000 vaccinations of Pfizer per day. The locations are Goldenrod Recreation Center, Meadowwoods Recreation Center, South Econ Recreation Center, West Orange Recreation Center, and we want to let you know that they are open tonight until 7 p.m. Then on Friday through Sunday, between the hours of 9 a.m. to 5 p.m. All of the sites are closed on Mondays. So far, nearly 500 residents have been vaccinated at our 4 sites. The Barnett Park drive-through COVID-19 vaccination lane has been picking up steam. 702 individuals have received a shot over the past 5 days. This site is both pedestrian and bike friendly. You don't have to be in a car, in other words, in order to get vaccinated at the Barnett site. It is open 7 days a week and is run by Orange County Health Services. Barnett Park also continues to offer free drive-through COVID-19 testing through the end of May. Also, if you're searching for a place to get a second Pfizer shot, our Barnett Park location, plus the Magic Gyms, all offer this free service. Since the start of the pandemic, there have been a reported 138,098 COVID-19 cases reported in Orange County. The 14-day positivity rate is continuing to decline. I believe it's continuing to decline because our residents are following the guidance that we are giving them. The overwhelming majority are still wearing facial coverings, social distancing, and doing all of those things recommended. Today, the positivity rate is 6.9% for the last 14 days. Last week, it was 7.9%. So I want to take a moment to talk about our business compliance, our strike teams. Tim Bolduc is here. For 214 days, they visited nearly 7,000 county businesses to make sure they had all of the proper tools to protect patrons and employees. Tomorrow at 11 a.m., we will have a short ceremony here in our chambers so I can personally thank the teams for helping to keep our community safe. The teams achieved a 99% overall compliance rate countywide. That is spectacular. So with 99% compliance, we really no longer needed the executive order to gain compliance. We had already achieved it. Since this is Small Business Week, we appreciate the efforts of our county businesses to keep their workers and customers safe. Behind me, you will see just some of the establishments that have shared photos and engaged with us on social media promoting how they are getting employees vaccinated and taking part in the I Got My Shot campaign. Well done to all of those businesses and all other persons who are adhering to the guidance. And now, National Nurses Week kicks off today and continues through May the 12th. There's a banner back there, I believe. It is a week to honor the commitment, dedication, and hard work of those in the nursing profession. During the pandemic, we have relied very much on our nurses. Our nurses have supported Orange County and the Department of Health in Orange County's testing and at the vaccination sites. They have helped save lives and kept our community safe and healthy. In our audience today, we have 6 nurses, 4 from Orange County government and 2 from the Florida Department of Health in Orange County. I'm going to ask our nurses to please stand and be recognized. We have Stephen Porter Sr., who is an LPN from our Corrections Health Services. Amy Walton, Health Services Administrator from our Corrections Health Services. Now, you know, being a nurse is always tough, but in a jail, it's a tough place. Lisa Meredith, RN from our Orange County Medical Clinic. Idalia Anduha from our Orange Medical Clinic. Catherine Carpenter, Community Health Nursing Director from the Department of Health in Orange County. And Joy Bailey, a nurse who also works for the Department of Health in Orange County. Thank you to our nurses for everything that you have done. And at the end of the press conference, we'll have you come up and we'll take some photographs at that time. So, you may be seated. Thank you. And now, Ms. Alvina Chu, the epidemiologist with the Department of Health in Orange County, will give you an update as well, and she'll be followed by the county controller, Mr. Field Diamond.
Thank you, Mayor Demings. As the mayor previously mentioned, we've had 138,098 positive cases reported to us here in Orange County as of today. Our recovery rate is up to 97%, and our 14-day rolling percent positivity rate is down to 6.9%. Unfortunately, we've had 13 additional COVID-19 related deaths reported to us since May 3rd, and we extend our condolences. We would like to let you know, in the spirit of transparency, the state has certified that one of the 13 deaths is in an 18-year-old Orange County resident. The individual had underlying health issues. The age ranges for these recent 13 deaths were 18 to 91 years old, with a median age of 62. 7 were female, 6 were male, 7 were Black, 1 was other, and 5 were white. 5 were Hispanic and 8 were non-Hispanic. 9 had known underlying health conditions, and 4 had no known underlying health conditions. 1 date of death is from August 2020, and 12 of these dates of death are from April 2021, and none were reported from a long-term care facility address. This particular case, this youngest person that we now have, who has recently died, highlights the urgency of individuals for all of us, even those in the younger age groups, to get vaccinated and to stay on guard and continue our pandemic precautions. So we know that there can be severe consequences for those who have underlying health conditions. We do know that young persons can still pass away, and we do know that the COVID-19 vaccines that we have are excellent at preventing severe hospitalization and death. As of May 6th today, since the last time we spoke, we've had a total of 52 additional variant cases reported to us, for a current total since January 1 of 549 variants. We've had, since the last press conference, 44 additional B117 variants, 2 of the B1429 variant, 1 of the B1351 South African variant, and 5 additional of the P1 identified in Brazil travelers. For all of our variant cases, the total age range is 0 to 97 years with a median of 34 years. We've had 5 deaths with variants recorded. 4 were the B117 and 1 was the P1. 5 were known to be hospitalized and 194 were known to not be hospitalized. 13 had known travel, and 189 of these variant cases had no known travel. In total, since we began vaccinations here in this county, we've had a total of 206 breakthrough cases. 33, about 1/3 of those were symptomatic, and about 1/4 of those had no known symptoms. Those age ranges were 18 to 99 years old with a median of 58, and 142 were female and 64 were male. So in regards to the recent information about the deaths and about the variants, which continue to happen and continue to increase in our community, we'd like to continue to encourage individuals who are not vaccinated to protect themselves with the vaccine. So protect yourself from severe hospitalization and potentially death, and also to protect yourself, your loved ones, and your community by practicing the good pandemic precautions so that we can decrease transmission and hopefully move very soon towards pre-pandemic or at least more normalized way of life. We encourage everyone in congregate settings, indoors or outdoors, to continue to wear a mask to protect yourself. And also, I'll just reiterate the pandemic precautions since I do. It's the wearing your mask, watching your distance, and washing your hands. Total doses administered of vaccine, COVID-19 vaccine in all Orange County, including all sites, is 957,346. This is an increase of 4,615 over the previous day. Orange County residents who are 65 years of age and older with a vaccine series completed, as the mayor had mentioned, is 72.58%. And all residents in Orange County who are 16 years of age and older receiving one or more doses of vaccine, we have 541,404, which is 46.17% of our eligible population. As a reminder, on May 7th and 8th, we will close the Orange County Convention Center operations to give our staff a well-earned break as we near Mother's Day. And in case you have forgotten, Mother's Day is Sunday, May 9th. Next week, second dose appointments at the Orange County Convention Center will open tomorrow at noon on the CDR Health Pro website. And we want to stress that these are only second dose appointments. In order to get a second dose appointment, you will need to enter your first dose information. If it is less than 21 days since the first dose, you will not be able to get a second dose appointment at the convention center. Again, I just want to stress that these are only second dose appointments next week. We will also offer the Johnson & Johnson vaccine at the Orange County Convention Center on May 20th and May 21st. To get the second dose appointment or an appointment for the Johnson & Johnson days, you can visit the CDR Health Pro website at www.patientportalfl.com. And finally, for those individuals who received Moderna a couple of weeks ago at the convention center, your second dose of Moderna will only be administered on May 14th and May 15th. We will still offer Pfizer second doses on those dates. And with that, I'd like to turn it over to Comptroller Diamond.
Thank you and good afternoon. Before I give my report, I would also like to express my gratitude to all the nurses. You really have done a tremendous job, and I feel like I know a lot about the nursing profession. My mother was a nurse as a single mother raising my brother and me, and I'm well aware of the sacrifices and commitment that come with the territory. So thank you to all of you, and let me be the first to say Happy Mother's Day to everybody out there, all the mothers, grandmothers, and everyone else that helps take care of their families. Good afternoon, and it is a good afternoon indeed. March 2021 TDT collections were $17.6 million. That's about a 27% increase over last March. That is the first increase in TDT collections since the beginning of the pandemic on a year-over-year basis. So that is really good news. Month over month, March collections were higher than February collections by about $7.3 million, or 70% since last month. And obviously, all of this is very positive news, very good news for all those people who rely on the tourism industry for their jobs and for their livelihoods. However, even though the news is very good this month, the percentage comparisons are very good, very high. I think we should emphasize that still, as far as March numbers, these are the lowest March numbers since before the pandemic. In fact, actually the lowest since March of 2010. So going back 11 years is the last time that March numbers were this low. That said, there are a lot of positive signs on the horizon. People continue to get vaccinated. Over 200 million doses have been administered in the United States. You just heard about the doses that have been administered in Orange County. And the CDC recently released its guidelines regarding travel and activities that fully vaccinated people can undertake. So I think all of that bodes really well for our tourism economy and tourism industry jobs. On the expenditure side, the county continues to use TDT reserves to offset ongoing TDT collections. For the month of March, reserves decreased by $7 million. Of the total drawdown, about $5.5 million was due to funding the 30-day operating reserve for the convention center. In total, the county has used about $138 million in reserves since April 2020. And finally, we will release the April collections report in early June. And I'm happy to take any questions when we get to the question and answer period. Thank you.
All right, thank you, Controller Diamond. There's good news in what he just said. So we are climbing back out of the hole that we were in last year. We do have the ability to do Spanish translation. We have Ms. Ilia Torres, and we also have Commissioner Gomez Cordero, who has joined us today. Mr. Scott Howard is here from the school district, if there are any questions regarding the district, and then we have other staff members for other questions. Mark Tester, the Executive Director from the Convention Center, is here also if there are any specific questions related to the convention business. The good news is that for the foreseeable future, the bookings at our convention center are up significantly. And so we, barring some tragedy or catastrophic developments, we should be fine this summer. So, all right, we're going to start over here with questions.
We'll start in Spanish. La pregunta, Edgar Carrillo de Telemundo, para el alcalde, tiene que ver con un poco un cambio en las medidas de precaución que han anunciado los parques temáticos, un comentario sobre si cree que este es el momento correcto para uno de los sitios a los que van la mayor cantidad de personas que no son residentes de nuestro condado y cómo lo evalúa, cómo evalúa este cambio en las medidas de los parques.
The question is for Mayor Demings, and it's regarding some of the changes that have been announced by the theme parks. Right now, at the moment, it's where most of the people visit from out of town, not locally. So how do you receive those changes?
The feedback I have received from the theme parks at this time is that they will generally follow the phasing that I talked about earlier. They will continue to require the social distancing. I'll stop so Ilya can catch up with me.
La retroalimentación que ha recibido el alcalde por parte de los parques es que continuarán el enfoque por fases que estableció el alcalde y seguirán continuando con el requerimiento de distanciamiento social.
So prior to issuing the three-phased approach that we announced a week or so ago, we did so in consultation with our largest theme parks, and therefore they're going to continue. They think it's just good business to continue following that guidance that was given.
Antes de emitir la orden por fase sobre el uso de las mascarillas, lo hicimos en consulta con los parques temáticos, por lo que ellos están en apoyo y entienden que debemos continuar observando esas medidas.
Okay, other questions?
Hey, Mayor Demings, I wanted to ask you, so the strike teams are ending, correct? Was that decision influenced at all by the governor's executive order to end local executive orders, since technically businesses don't really have anything to comply with? The guidance you're giving now is just suggestion. Can you talk about that?
Well, just remember that the strike teams or the compliance teams here in Orange County existed solely because of the direction that I gave here in this county to gain compliance. We gained the compliance at 99+% of the businesses. We used it proactively. We hadn't really issued many fines at all, even prior to the governor removing the ability of our county or counties to issue fines. So the goal in the beginning clearly was to gain compliance of the businesses within our community, and we achieved that. For a considerable period of time after there were no fines put in place, we continued to maintain that compliance. And there may be some businesses in Orange County who no longer are following the CDC guidelines requiring the wearing of facial coverings or the social distancing. But I think that that would be a rarity. When I have moved around the county, the overwhelming majority still following that guidance. And so part of my goal today is to give guidance. You know, one of the fundamental reasons that government exists is to keep the people safe, to give guidance. In the absence of guidance, then that creates confusion. So my attempt today is to talk to our community about what it is and how we will move forward as a community. And I believe that our community will respond affirmatively in agreement with the direction we're given. There was always a few who just wouldn't follow the guidance. There were people who did not believe in the science behind the requirement to wear facial coverings in the first place. They thought it was an infringement on their rights and all of that, and they're still out there. But the overwhelming majority of people in this county understood the gravity of what we were dealing with, and they did not want to contract the virus, didn't want to spread it to family members, and that was the right approach based on all of the expert opinions from those who were qualified, well qualified to give health-related opinions. We have been consistent in our approach for these 14 months or so.
I'd like to get a reaction from both Mrs. Chu and Mayor Demings on this one. This is in regards to the crowds that we're seeing at the mobile sites. A quick look at the number. I mean, 1,000 shots available at Goldenrod, 35 people showed up. 1,000 available at West Orange, 37 people showed up. I did the math quickly. About 10% of all the shots available yesterday went into arms, only 10%. So your reaction to that, is that concerning, and the message? And I'd like to hear from both of you if possible.
I participated in a White House in a governmental affairs conference call immediately prior to coming down. And all across the nation, there's a slowdown of people getting vaccinated. So you've heard Dr. Pino even say that up to this point, historically, the people who were truly desiring the most to get vaccinated have likely gotten vaccinated. So the remainder is going to be a challenge for us. And we as a community are going to have to try to encourage our friends and family members who have not been vaccinated to voluntarily get vaccinated. So our strategies in order to get the numbers up includes being in a position where it's convenient for our residents to get access to the vaccine. So the good news is that while the numbers have declined significantly, people are still getting vaccinated. We had good success over last weekend by offering the vaccine at Barnett Park. So we believe that that's a good strategy for those who may not be able to get vaccinated during the week. So we have created that opportunity closer to where residential neighborhoods are located. We have the mobile unit going out and about. So I don't want to sugarcoat this. It's going to be a challenge to get up to that 70% threshold at this point. The White House IGA said that at this point, some 250 million Americans have received at least one dose, which represents about 56% of all Americans. And I share with you here, we are, for those 16 and older, we are at 46.17%. We're trying to get to 50% so we can remove the facial coverings for outdoors. 70% to reach that community immunity that we are striving for in this community. We will not get there without everybody's help to get there. So we still have a ways to go.
Thank you. And as the mayor had mentioned, Dr. Pino has previously spoken about how the campaign, when we initially started, looked a little bit different. So vaccine supply was smaller and restricted, and we were targeting or prioritizing towards those who were the most medically vulnerable, such as our elderly population and those who lived in nursing homes. And so the initial rush was people who really wanted the vaccine got the vaccine immediately. So you would refer to the magic number or the target goal. So even if we don't reach that, we are striving towards it, but every person that we remove from the susceptible pool helps us get a handle on the pandemic. So regardless of that target number, everybody who gets vaccinated helps us reduce the spread within our community. And so, as the mayor had mentioned, we were working to try to bring the vaccine out to those persons to make it easier. I think there was a mention about starting the campaign to go into businesses and working collaboratively with private industries to try to get on-site vaccines so that we can increase the numbers. So, thank you.
Nikki Zizaza with News 6. This question is for Alvina Chu. You had just mentioned that an 18-year-old passed after being infected with COVID-19. Was this 18-year-old exposed to one of the variants? It sounds like there were many that you listed off that you're reporting now. And at the same time, there are a lot of young people who, are arguing, look, we're not the ones who are suffering from these severe symptoms, and so we will likely be okay unless you have some kind of underlying medical issue. But I know that you guys have really been trying to push for young people to still get vaccinated. So what can you share with me about that young person and the message you want out?
Well, really, so we don't know about the variants yet, because I think I'd mentioned that the potential for the sequencing comes several weeks or potentially later down the road. So we also may never know whether or not that person was infected with the variant, but it would not necessarily matter because the young person still became very ill and eventually passed away. And so regardless of whether it was caused by the variant or not, we know the variants are here. We know that we still have virus circulating in our community, and we know that we have excellent vaccines that could have prevented, hopefully prevented this death. And so we would like to encourage persons, we don't know specifically who or how the COVID-19 vaccine might affect those younger populations. And so we encourage everyone to get the vaccine, especially those who are younger.
This is Melissa Thomas with Florida National News. This question is actually for Mr. Tester with the Convention Center.
Mark Tester. Come on back.
Mr. Tester, just wanted to get your feedback. Mayor Demings mentioned that obviously in light of the governor's executive order, he had started hearing from residents within Orange County about their concern for their safety. But I wanted to find out from you, given the now influx of people that are going to start holding conventions at the convention center, have they expressed concerns to you, vendors or event producers that are doing things at the convention center? Have they expressed any concerns of safety in light of the governor's executive order?
So all of our events, we work very closely with in developing their own health and safety plan, and so they are literally partners with us on that. And so that is within their control. They do make qualifications on who comes to an event and entrance. So we're working with them, and most all events that I've spoken to are still planning to go forward with all the same safety plans, whether it be temperature checks, masks, other protections, certainly hand sanitizer and everything. So we have not heard any concerns. We are talking, we are developing plans, but we do believe that all of our events will be still wearing masks.
Lauren Seabrook, Channel 9. Alvina, my question's for you. I wanted to see if you could share with us maybe what the response has been from the businesses and even small groups of people who are requesting to have the mobile unit come to them, if you've seen a lot of interest in that or if it has been low.
I think it's been well received where the mobile units have gone. I'm actually not the best person to answer that question. So I can have Dr. Pino try to address that about the vaccine operations side.
is for Mr. Diamond and for the mayor. Mr. Diamond, you talked a little bit about the amount of reserves that we've used from. We had stopped the expansion of the convention center. What would have happened if we had, if you could offer an opinion for that? And for Mr. Mayor, is there any plan to resurrect, as things are coming back, resurrect the expansion?
Well, I'll take the first stab at it. There's no, there's no immediate plan to resurrect the expansion. We will have to see significant increases in our TDT revenues in order to do that. So, you know, at one point pre-pandemic, we were seeing $30+ million coming in on a monthly basis, and we're at 17.6, relatively speaking, for the last 12 months. That's not bad. That's the best it's been. The good news is we have a number of shows and other things. Our leisure business is picking back up here in the community based upon feedback I'm receiving from our hoteliers. People are traveling, and our international travel is not back yet, but domestic travel, we see we're leading the nation almost every day in terms of air passenger travel numbers that's taken by the TSA. So that's the good news that I will tell you. So fortunately, we had healthy reserves. We stabilized the expenditure out of those reserves. We still have the asset of the Orange County Convention Center that we still have to maintain. We are doing shows. There are shows in the building right now that requires us to keep our facility show ready at all times. We've been fortunate to have some shows relocate from other communities where they were not open here in the U.S., and they have come here. So we have had the right look at the right time. Obviously, this is a multi-billion-dollar industry for our community, and I believe based on the shows I read somewhere, Mark, in terms of the shows that's booked through the remainder of the year, economic impact estimated at $1.85 billion. Is that the number? $1.85 billion worth of economic impact on those shows for the remainder of this year. So that's really good news, because that keeps people working here within our community. It allows us, as the revenues increase, to not have to go into reserves. So the public policy decisions that were made, the operational decisions that were made early on has allowed us to be in this position where we are now. So I'll turn it over to the controller. He cuts the checks and gets the deposits. So,
And fortunately, there were more deposits in March than we've seen for a while. That's a good point, and it's a good point that the mayor made. I mean, 17+ million in March was good, for sure. It's the best we've seen in a long time. And it was more than March of last year. But keep in mind, March of last year, you had a good first half of the month, and then the second half of March last year, the bottom fell out. The theme parks closed. The word about COVID got out all of a sudden. I think the NBA shut down, and life as we knew it came to a close. The year before that, it was 31 million, like the mayor said. So, comparing our 17 million to 13 million, sure, that's a lot better. But comparing our 17 million to 31 million, that's worse. And like I said, I mean, it's the worst March that we've had other than last year since 2010. Where would we have been, Steve, I think was your question? I think we would have been hurting. We've spent $140 million, and I don't know that there's another community in the country that could have done that. We started out from a strong place, which was great. It was great that we had healthy reserves. But it's a huge hit. And, The fact that we had those reserves kept our bond ratings from being cut when other governments, other local governments around the country saw their bond ratings get cut. I think if we hadn't had the reserves, our bond rating would have been cut, no question about it. And I think the mayor's decision last year to stop the convention center projects was the right one from a financial standpoint. I can't imagine where we would be at this point. We have, not to get too technical, but, we have to keep a certain amount of money in the bank to pay our bonds, the mortgage, if you will. We have to keep a certain amount of money in the bank to make sure that if a hurricane took the roof off the convention center, we'd have money to replace it. Once you get past those two amounts, I think we've got $40 million left. So it's a lot of money on one hand, but when you have months where you've had $30 million hits on your reserves, it doesn't look so large anymore. So, I think the message is we should be thankful that we had so much in reserves last year. It allowed us to continue. It allowed us to pay our bills. It allowed us to maintain what we had to maintain as far as the convention center and paying our debts. But I think the impact of taking anything else on would have been huge. There's no question about it.
Okay. Mayor Demings, I have two questions. The first is for Alvina Chu. Ms. Chu, the question comes from Alexa with WFTV, and her question is, the Pfizer vaccine for use on children 12 to 15, what is in the works to make the shot available to them, and are you working on pods with the schools?
I think that might be a joint question between us and perhaps OCPS, but we have been in consultation constantly with OCPS. The several high school sites that were opened recently were we think very successful in bringing the vaccine to the community. So we look forward to the opening and expansion of the population to those who are younger so that we can prevent severe hospitalizations and deaths there and also reduce transmission.
Yeah, thank you, Alvina. We've been obviously working very closely with the Florida Department of Health in Orange County, coming up with very specific sites where we can locate these pods, specifically to our 16 and olders right now. And then moving forward, what we'll do once we're authorized to give the Pfizer vaccine to our 12 and up. So we're thinking ahead and working ahead and making sure that we have plans in place to do that. So thank you.
I did have a point, since we've had several questions about vaccines, is there are currently people who can't yet get the vaccine. And so we wanted to continue to encourage and put out that public health advice that everyone continue to practice the pandemic precautions. If you can't yet get the vaccine, to wear your mask, watch your distance, and wash your hands to concurrently until you are able to get the vaccine for us to be able to get a handle on this pandemic.
Okay. And the last question is for Comptroller Diamond, coming from Ryan Litch with the Orlando Business Journal. And his question is, what kind of expectations do you have for the TDT collections coming into the summer, and have recent increases surprised you?
Well, I think in the short term, I think TDT ought to be good. I recently traveled, and the plane was full, 100%. Plenty of kids on the plane. They made their presence well known, and for tourism and for Orlando, that's really good. Will that continue? I hope so. There's so many variables, and that goes back to why you have reserves, is you just never know what the future might bring. It might be very, very positive. It might not be. And reserves aren't just for, we had to use the reserves for pandemics, but there are also other things that in the past have really hit Orange County pretty hard. We had, the Great Recession about 10 years ago. We had 9/11 about 20 years ago. And hopefully nothing like that ever happens again, or doesn't happen again in our lifetimes. But, you never know about the future. We do think it looks very good in the short term, and then hopefully over the longer term, it continues to look good. And, we continue to be hopeful. And in the meantime, we're going to do everything we can to make sure we have reserves for important things. That's why you have reserves. And, but hopefully that won't be an issue for a long time.
The only thing I add there is we were not alone. Every community around America, around the world, experienced the same thing we were. So in terms of the competitive market that we work within, we're as good as anyone, probably better than most. So with that, this concludes this press briefing. The next press briefing is scheduled for Monday at 4:30, May the 10th